Hi, Dr. Crystal here, and this video is on knowing your rights and what to do after you're in an accident. So we're here, first of all, to tell you how sorry that we are that you were injured in the accident in the first place. We understand from personal experience that this can be a really challenging time, and it also can be very stressful, and sometimes you just don't know what you're supposed to do or how you're supposed to do it. And we want you to know that you're not alone. In Minnesota alone, we have a higher than average accident rate. So the average American rate is one car accident every 10 years. In Minnesota, we have one accident every 7 years. So chances are you've probably been here in this sort of position before, but there are a lot of great experts and things out there, and we want to make sure that you are taking care of your car, of course. That's always a lot of times what people look at first if they're not in a serious accident, but we also want you to make sure that you're taking care of you and your body and getting the best possible care that you can have. So to introduce you to our clinic really quickly, we're Advanced Medical of Twin Cities. We are a physical therapy or physical modality clinic. So we have multiple therapies in one area. We have chiropractic, we have acupuncture, massage therapy, dietetics, nutrition. We do rehab, we have yoga, we do a whole bunch of things all together in one. So we're really trying to make it be a one-stop place for you and myself. I'm Dr. Crystal Lieberman-Wall. I joined my dad in practice, and he has been in practice and opened the practice about 40 years ago. And we have combined with us and our associate, Dr. Billy, combined over 55 years of experience. And we are here to really help you, and we've helped a lot of people through car accidents and injuries, other sorts of injuries, the whole family as well. So we work with people from the day they're born all the way through adulthood and into the geriatric population too. So whatever situation or whatever life spot you are in or your family's in, we're here to help you. So the first thing that you have to do is make sure that you are seeking medical care if you need it. So emergency medical care. A lot of those sorts of things can be very obvious. So things like broken bone or external bleeding, loss of consciousness. People do usually go out and seek medical care for those sorts of things. But there's also some little warning signs that we want you to be aware of that are not as obvious. They can be a little bit more hidden. And some of those things include shortness of breath. You could have bruising or intense pain over your abdominal region or other organs. You could have green goo coming out of your ears or your eyes, forgetting things, short-term memory loss. Things like that are stuff that we want you to make sure that you seek medical care right away. And if you're questioning a severe injury like that, it's always best to get in and call 911 if it's something very severe, or call your medical provider as well. And then the next thing that we want to talk about, though, are the majority of injuries that we see in people that have been in a car accident. And the majority of the time, these injuries from a car accident are involving the muscular system, the joints, all of those sorts of regions. So it leads to things that don't necessarily require an ER visit, or maybe you went to the ER to make sure nothing was broken, and now you're ready, like, okay, I'm still having this headache, or my neck still is sore. Maybe it's just some generalized pain, like you're having some stiffness and achiness in your neck and back, or in a foot, maybe you press the gas pedal really hard, and so now you're feeling it in there. So that could be something too, and they can vary greatly in severity. And one thing that you really need to understand is that even if something seems small, so people have a good way a lot of times of getting in and getting treated or getting things checked out if it's a big pain. But a lot of times people think, oh, I'm stiff, I was in an accident, it's to be expected. Or maybe they're starting to feel stiff a week or even a month after the accident, and they're wondering about, oh, could this be related? I've never had pain like this before. It's just a really good idea, even if it's, quote, a small thing like stiffness or a mild headache or something just not feeling right. It's really good if there's anything new. And if you get nothing else out of this, I do want you to understand, if there's anything new, you want to get an injury evaluation by somebody that knows what they're doing, and works with people that are in and have been in car accidents and had whiplash style injuries before. So if you think about a heavy car compared to your body, so obviously people know there's no way that your body is the same weight as your car, right? So the force of the car, and as you strike anything, even going slowly, is that force has to go somewhere. It doesn't get completely absorbed. We have a lot of wonderful things in our cars that try and absorb as much shock as it can, but there's still a big amount that can go through our bodies. And a car just traveling 10 miles per hour, so just pretty slow, that hits a stationary object, so not even both cars moving or anything like that, has around 50,000 pounds of force that is going through that person's body. So even if there's not a lot of body damage to your car, or you feel like, oh, it was just little, if you're having anything new, get yourself checked out right away. And like I said, it could be a delayed response too. So pay attention to any of that's happening in the next, even month or two after the accident as well. The next thing is to look at is, it's really nice if you can find a clinic very similar to ours that has a multidiscipline approach. So it has a lot of different therapies and modalities into one location. So when you're looking for a provider, you can ask a lot of different questions to make sure that they're equipped to treat car accidents, and then also to see if it's a good fit for you. So the first thing is to literally ask them and find out, do you treat people that have been injured in car accidents? Like I said, it's important to find people that have worked with patients like you, so that the team will know how to get you back to the things that you love to do, and doing everything that you want to do, but also have really good quality and expert care specific to the whiplash style injury that you've experienced. Knowledgeable providers will know that they can help you, and they'll also know when it's time to refer you to a different specialty or a different type of provider. Or if they see something that's like, I'm a little concerned of some internal bleeding or something like that, then they're probably going to go ahead and refer you right away to the ER, something like that. So if you're questioning things and you didn't think that it was emergency, they can be a second check to look for you. But that's another option as well that we have as good providers, is always making sure that we are doing what's in your best interest. And that's something that you want to find in a good provider. The next thing is, you can always check out their reviews. So check out places like Facebook and Google. Finding a good provider for injury care is very similar to finding a good mechanic. So talking to people that you know that have been in car accidents before is another great way. Remember that, not every location is for everyone. And I think most of us have had someone say something maybe not wonderful about us at some point in our lives. So I'm not saying that if they have one bad review that you don't take a peek at them. But definitely look and see, is it generally a good review, or is it a 2-star review and there's 1,000 people that have reviewed the place or something? That might be a good indication that it's not a good fit for you. Versus somewhere that, your neighbor went and saw a provider and they're doing so much better now. So those are great ways to check it out. You can also, of course, talk to other providers that you've had for other things and see if they have any other good ideas for you. The next thing to do is to ask literally the office if you can just come in and get a vibe and get a feel for the location and see if it's a good fit for you. There is, for chiropractic, for instance, chiropractic's an art form, and a lot of clinics are run very differently. So one type of clinic might not fit you well, but it doesn't mean that all chiropractic doesn't work well for you or isn't a good fit when you walk in the door. A good clinic, most clinics will allow you to come in, have a consultation with the doctor and everything, usually at no cost to you, to be able to see if it's a good location for you to check things out. And that also gives you an opportunity at little to no obligation to figure out if this is going to be a good feel and that you want to continue with that practice. The next thing that I would say is when you go into the clinic, the environment should make you feel like a person and not just a number. So there are a lot of places out there that treat car accident injury people, and it's really set up like a warehouse or something like that, where it's really one size fits all. And I know that I am not the same as my husband, and we're not the same as our 8-year-old or our 6-year-old, and we're not the same as our parents, right? What our bodies need is different. Even if we're all in the same accident, what is going to get me better might be totally different than what gets my husband better, even though we're relatively the same age, or my best friend who we're about the same size and everything else. How our bodies respond to trauma can be very different. And so I really like if you find someone that's going to give you that really personalized approach and listen to you. You want to find someone that listens to you and your concerns with empathy and knowledge on how to help you. So they've worked with people in this situation before. They might have, okay, we're going to try this first, but if this isn't working, we're going to switch over and try this, or something like that. They also might do special kinds of testing or things to make sure that what they're doing is safe and appropriate for your injury. So you really want to make sure that you're also involved with the doctor with the plan of care, and that it involves you personally agreeing to whatever plan comes through, and also having some steps of things that you can be doing at home to help yourself get better quickly. So the last thing that I wanted to talk about today is the state of Minnesota, which I'm assuming most of you are in, is what's called a no-fault state for car accidents. And that can get kind of confusing for a lot of people. They don't really understand what that means. But a brief explanation, or the easiest way that I have always found to explain it, is that the state of Minnesota wants to make sure that you have care for any injuries that you have in a car accident or have sustained from in any way relating to a car or a motor vehicle. They want to make sure that you have coverage for that. And so under most circumstances, just being in the accident itself, whether you caused it or you were just, you got hit or anything like that, that's typically the only thing that affects your insurance rates. A lot of people kind of avoid seeking care because they think that, oh, if I get worked on or if I get my neck checked that I'm getting these really horrible headaches from, they think that their rates are going to go up even more. And under most circumstances, that's not the case. You just being in the accident is what makes the rates change, depending on your car plan and everything. So understand that for the most part in the state of Minnesota, you can come in and get treated and seen and get injuries specific recommendations and everything at no cost to you under most circumstances. Sometimes some people do have a small deductible for bodily injuries. If you're a passenger in a vehicle, you are for sure covered. If you were hit by different things, there's lots of ways that Minnesota really helps protect you and prevent you from having to worry about care financially after you've been in an accident. So just keep that in mind. If you would like more information on your legal rights, so that's not my expertise, but I do know a few wonderful lawyers that can get you a lot of really great legal advice also, and explain all these little details and be more specific to the plan that you have. And I'll put a link down below for one of them that I have talked with and everything in the past that I think is a great resource, and she wants to make sure that you have all the information you need on the legal side. So I'll put that link down below. If you have any other questions, please don't hesitate to give me a call, come on in, anything like that. We're here, Advanced Medical of Twin Cities. Our phone number is 763-541-1280. You can also email me at dr.crystle, Krystle, .wall, WALL, @gmail.com. And we hope that this video helps you. And definitely please let us know. Like I said, we're available for you. Even if you're not in our area, we'd be happy to help you find someone in your area, or if you have questions about what kind of provider you should see or anything like that too. We're here for you. So give us a call or an email, or check out our website. I'll have all the information linked down below as well. And I hope that this is helpful and you have a wonderful day. And I hope that you are on the road to recovery very fast. Have a great day. Thanks.